conversation a couple of weeks ago about what metastases look like in the liver, in the cirrhotic liver, sorry. So I figured I'd bring some. I say a few cases. So this patient has a gallbladder cancer. You can see this big ugly mass. And clearly there's cirrhosis. And of course, we have, arterial and portovenous phases. And, what we see in this patient is these ring-enhancing masses, right? So they have peripheral arterial phase, rim arterial phase hyperenhancement, which is a feature of LRM. Generally in cirrhotic patients, it's a feature of cholangio, but as you can see here, it doesn't have to be cholangio, right? It's a feature of adenocarcinoma. The metastases in liver, in cirrhotic liver, are not common. Cirrhotic liver is hostile, so even when patients have primary malignancies, they don't tend to metastasize when you have cirrhosis. So that's one good thing about having cirrhosis. But even though they're uncommon, it doesn't mean that they're 100% protective. So this is just an example of what metastases look like on CT, and a similar case I'm going to show you. This was an incidental finding. Patient came in for screening for HCC and was found to have this big mass. You can see in the pancreas, hypointense on T1. Notice how nicely it stands out against the T1 hyperintense background of normal parenchyma. When we give contrast and you see arterial phase, you see again all these, normally we would call these ring-enhancing masses, but, if we're going to use the Lyra's lexicon, these are masses with rim arterial phase hyperenhancement, which is again, any of these just one of these features is enough to call something LRM. And you can see that here they become kind of almost invisible on portovenous phase, which sometimes liver mets do that, which is very disconcerting because you just can't see them sometimes in portovenous phase. Here's the primary tumor. So the metastases, another important thing to remember that HCCs tend not to be super duper restricted. So this is the primary tumor. You can see here that all these little tumors, little mets, show, what in Lyra's is defined as marked restricted diffusion, where the brightness of the lesions on diffusion weighted sequences is equal or brighter than the spleen. Usually HCCs don't get to be this bright. They're usually either slightly bright on diffusion. So this is actually an important point to make, because if you have lesions which don't meet criteria for Lyra's 5, so if they meet criteria for, let's say, Lyra's 3 or Lyra's 4, and they have markedly restricted diffusion, that is enough to call these lesions LRM. Now, in this case, it's irrelevant because all of these have kind of these ring arterial phase hyperenhancement, so that's already enough to call them LRMs.
Sure, I'm wondering if it could be a neuroendocrine tumor because of all these arterial enhancing.
So theoretically, but this is not. This is met pancreatic adenocarcinoma.
Mm.
So remember that cirrhotic livers have different vascular patterns. They have different patterns of vascular supply to the liver, so that sometimes what we normally see as hypovascular metastases in cirrhotic livers will look a little bit different. So this rim peripheral hyperenhancement is very common in what normally is hypovascular metastases. So just to go back to the first case I showed, this is also gallbladder mets are typically hypovascular, right? But you see nice areas of rim hypervascularity in these mets. So the good thing here is that we don't have to give the different. I mean, here we have the primary, and in the other case we have the primary. So I just wanted to show the examples what mets would look like in a cirrhotic liver. And just like quick final case.